Since leaving the care home and becoming more mobile again, I've had time to reflect on my experiences over the past few months. I've been researching the integration question, and basically the number of people who have health problems requiring health and social care is increasing. So that's more people with complex health needs requiring a combination of health and social care services, and as we are aware, these services don't always work well together. For example, people are sent to hospital when it would have been better if they'd got care at home. Sometimes people get the same care twice from both the NHS and social care organisations, or an important part of their care is missing, leaving them at an increased risk of harm. I realise that care is changing and being driven by governments because people are living longer and there's less money in the pot, but are we, the public, able to keep up with these changes? In the last few months, I've heard of care closer to home, better care together, care navigators, individual service funds, to name just a few. And then there's the Care Act being implemented, with even more changes to come. How on earth are vulnerable people going to understand all these changes and the jargon that goes with them? Especially if health and social services aren't working together as they need to, or talking or listening effectively to each other. I think I was lucky, as I did see some empathy and compassion. Perhaps I even saw signs that integration is starting to work, but there's still a very long way to go. To begin with, professionals from both sides have to understand each other's roles and be committed to working together to make the situation better for everyone, including themselves. They mustn't ever forget, though, that the perspective of the person needing the care or the service has to be the organising principle, or an opportunity to make things better will have been lost and it will all have been in vain. As I'm so much better now, I thought I might go and do a talk around this integration issue to some of the local WIs. That'll stir things up a bit and hopefully get health and social care talking.